happy to be back here in Ulku. It is a sign that Ulku is a very open-minded university, that you have agreed I should talk about the very controversial and rather un-Catholic subject of euthanasia. It is probably not a big question in Ukraine at the moment, but it will become one, probably, because it is a major political question in many, in fact in most European countries now. And of course there are several countries where euthanasia, although I'll discuss the name we should use later, where euthanasia is allowed and is legal. So in fact we have some evidence from countries where it is permitted to see how it works out in practice. It is very difficult, and I speak as a doctor who has been dealing with death and dying for almost 40 years. Even now, I find it very difficult and painful to think about it, both for my patients and for myself. We all naturally run away from thinking about it. I've just come from the Children's Hospital in Orlika Street, where I saw 3 children, 2 with brain tumours, 1 with a severe head injury, and I felt forced to tell the parents their child is going to die. And they had not really been told that before. And I can tell you it is many times more terrible for the parents than it is for me. But for any kind doctor, conversations of this sort are very, very painful. And it is human nature to try to avoid them. But if we are not honest, if we are not truthful with our patients and their families, it ultimately makes the job and the practice of medicine more difficult. As I said, in England now, the question, it is against the law, euthanasia is against the law, but it is a very big political issue, and not every week, but very often there will be newspaper articles about patients who either have gone to Switzerland, where they can die legally, or when they take their case to the English courts and try to argue with the judges that a doctor should be allowed to give them, it's usually a barbiturate drug, with which they can then bring their life to an end. So there are no countries left in Europe, other than Cyprus and Georgia, where suicide is against the law. As you probably know, in most of Europe until the 20th century, it was actually illegal to try to kill yourself. And there are extraordinary stories in England of people who tried to kill themselves and failed, and then were hung, were then executed for having tried to kill themselves. But that now, suicide is not illegal, so we have a paradox. Why is it against the law to help somebody to do something which is not against the law? So it clearly needs, if you believe that assisted dying, euthanasia is wrong, you need to justify it a bit, because obviously it is a problem. It's not against the law, so how can it be against the law to help somebody to do it? Now, modern medicine means we live much longer than in the past. That is starting to happen in Ukraine now. It is already a problem in Japan, the Western European countries, America, where there are more and more very old people. But the more important point is modern medicine has now given us the diagnostic ability to predict death quite a long time before it comes. Until the age of modern medicine, we went on living, we then developed a serious illness, and we probably died quite quickly. But now with scanning, with radiology, things like that, we often can predict that somebody will die, maybe not tomorrow, but in a few months' time or even years' time, with diseases like motor neuron disease, which is a progressive neurological paralysis. So we have many more people now than in the past who know their life is coming to an end. And this was not the case, really, in the past. Now, there are many different names which sort of mean the same thing. Euthanasia comes from the ancient Greek. It means a good death. But the word euthanasia came to be associated, where are we, there's a picture. It came to be associated with the Nazi Germans, who had a program of killing, murdering psychiatric patients and people with disabilities. And certainly in Germany, there is no discussion about euthanasia or doctor-assisted dying, because it is historically such a sensitive subject. But as I will be saying in my talk, the question of euthanasia, doctor-assisted dying, is about patient choice. We are not talking about doctors deciding when somebody's life should end. Although often in medical practice, we have to make decisions like that. At what point do we stop treating people? But that is a separate question. So there are various phrases. We can call it euthanasia, but on the whole, when this problem is discussed in European countries, we do not call it that because of the Nazi German history. You can call it assisted suicide. Some people call it doctor-assisted suicide, but it need not be a doctor. All that is required is that it would be legal for patients to be given a drug which they'll fall asleep and then die from respiratory arrest. So you can call it assisted dying. The phrase in England, which is usually used, is death with dignity. Now, there are two forms of assisted dying. You could call it sort of euthanasia heavy and euthanasia light. The most common form, which is in many of the American states, now in Canada, some of the Australian states, is if you have a prognosis, if the doctors know you'll almost certainly die within 6 months, and this usually means cancer, it is legal if you ask for it and subject to safeguards that independent doctors have to make sure this is your true decision. You are not being forced to do it by anybody else. It is legal for you to bring your life to an end a few months earlier than would otherwise be the case. But there is a second form of euthanasia which is available in the Netherlands, in Japan, Switzerland and Belgium, where you do not necessarily have to have a prognosis of 6 months, but if you are faced by, in English we call it intractable suffering, you are allowed to bring your life, you're allowed to help somebody to bring their life to an end. So the example would be somebody paralyzed from the neck down, who cannot move, who may decide they do not want to live like that. Some people have a very satisfactory life, completely paralyzed, like Christopher Reeve, Superman, although he was a millionaire, which had a reasonably satisfactory quality of life, although it was very, very difficult. Or the neurological degenerative diseases like motor neuron disease. And the other possibility is with the early stages of Alzheimer's and dementia. I do not know if anybody here has had a parent with Alzheimer's. I have. My father died from Alzheimer's. And in the early stages of the disease, people can still make rational choices, even though their memory is failing. And I know several senior doctors in England, older than me, who were diagnosed with Alzheimer's and chose to go to the Dignitas clinic in Switzerland to bring their life to an end, because they knew that they were faced by several years of steady mental decline. So there are, in the countries where euthanasia, assisted dying, is legal, there are many safeguards to make sure this is a freely made choice. If you go to the Dignitas clinic in Switzerland, it costs tens of thousands of dollars. You have to have many, many medical reports. You do not just go to Zurich, press the door button and say, give me the suicide pill. It is a very complicated process. And they refuse more applications for assisted dying than they actually accept. So, as I said, countries where it's legal, I've discussed that before. Now, the method of euthanasia is usually a barbiturate tablet, a drug with an antiemetic, so you don't vomit it up. It is like having an anesthetic for an operation, but you fall asleep and then your breathing eventually stops within probably 2 or 3 hours. It is quite painless, quite comfortable. It is a simple process. If the patient cannot swallow, then obviously somebody will need to administer a barbiturate drug with an injection. And as I said, it is a very easy and comfortable way to end your life. Why should one want to do that? Well, bear in mind, everything I say is about choice. This is about voluntary euthanasia. It's not about the involuntary euthanasia, which the Nazis practiced. That, by the way, was an advertisement of the Germans saying life without hope. They said these people live miserable lives in hospitals, therefore they're better off dead. And obviously this is a huge, terrible crime against humanity. I'm getting backwards, sorry. So as I said, assisted dying is a voluntary suicide. And remember, tens of thousands of people kill themselves every year. I'm not saying that is a good thing. But when you see statistics about America where 35,000 people die from gunshot wounds every year, half of them, in fact, are suicides. And this is not, and it must be repeated again and again and again, this is not about doctors deciding when somebody should die. Now, after the Second World War and the criminal Nazi regime and the Nuremberg trials, and many doctors were sent to prison, not enough, but some doctors were sent to prison for killing patients, for medical experimentation on patients. It was established what are called the idea of medical ethics. The Nuremberg Code was established. And the 4 principles of medical ethics, the 4 pillars, are firstly autonomy, that as doctors we must respect the patient's right to decide what is best for them. We should not decide as doctors what is best for our patients. We advise patients, we can recommend things, we can tell them what the choices are, but we do not say, you must do this. Sometimes in Ukraine I think it's a bit different. Beneficence. Our duty as doctors is to do good, to state the obvious. And non-maleficence, we have a duty, we must not do things knowing them to be bad. And justice, we must treat all people equally, irrespective of their race or sex or anything like that. And the argument, the debate about voluntary euthanasia, assisted dying, is all about patient autonomy. As I said, how can we justify not accepting somebody's decision for their own life? It may, as young people, it may seem strange to you that somebody could want to bring their life to an end and they're not depressed, they're not mad, but there are many situations in life where some people, not many, can look at their future, can look at their death in the face and say, well, actually, I prefer to die soon rather than later. So the point is, there are, of course, many ways of dying. Death is the same for all of us, but but it can be fast and painless if you have a major heart attack or a severe stroke. It can be slow and painless, usually if you have liver failure or kidney failure, as often happens with cancer. It can be horrible and slow. I will not show you pictures or give you details, but people dying from malignant tumours that destroy the face can be terrible, and it can go long. A friend happened with the wife of a friend of mine, and it was a terrible, terrible process. The great psychiatrist Freud died from a facial cancer, and at the end was he actually got his doctor to kill him with morphine, because by the end of his illness, the smell from his rotting tumour was so bad even his dog would not enter the room. And I looked after patients when I was a young doctor. So it can be a very, very terrible business. It can be due to progressive paralysis, as a motor neuron disease or tumours in the spinal cord, and it can be slow and painful depending. So the point is there are many different ways of dying. There's not a single process. Even though once we're dead, we're all the same. And it can be fast and painful sometimes, as of acute peritonitis or a ruptured abdominal aneurysm. Many, many ways of dying. Now, what are the arguments against it? Well, there is the religious argument, which obviously many people here at Uku would believe in and accept, and I have no problem with that. But this is a question of belief, that you have to believe in some way it is against God's law, and you can't really argue about it rationally, because you cannot argue about belief. Belief is something you believe in. It is an act of faith. I respect faith, but my faith is I do not believe that God has said it is a bad thing. And as the great English philosopher Bertrand Russell said, if you cannot provide any evidence for what you believe, I do not have to provide any evidence to say that you are wrong. So we cannot argue today about the rightness or wrongness of the religious argument against assisted suicide. Now, the point about this is, in countries like England, unlike Ukraine, England is an increasingly non-religious, secular society. Most people now, the majority of people now say they have no religion at all, and even people who say they're Christian, only is less than 5% of the population go to church every weekend. And this change, this decline in religious faith is happening in most European countries, and it probably will happen in Ukraine in future, but I'm talking, if the majority of people are not religious, you cannot really argue against assisted dying on religious grounds, because the principle of democracy, a minority of people with religious beliefs have no right to impose their beliefs on everybody else. So I think everybody accepts this in England, so the argument against assisted dying has to be argued in different terms, and it becomes a question of evidence and what will actually happen if assisted dying is permitted. What are the possible problems? Because obviously we do not want people to commit suicide when maybe it's a bad thing or it is unnecessary. Opinion polls of the public in Britain always show, and have done for many years, a strong majority of people think it should be legal. Most of us think, well, if we are faced by a horrible death, we would rather die sooner rather than later. Obviously, once you are dying, you may feel differently. But for what it's worth, that is what opinion polls show. And yet the Parliament has regularly rejected laws to make it possible. Why? Well, there are various non-religious arguments against assisted dying. The first is, and this is an argument presented by many palliative care doctors, that when we are dying, we are vulnerable, we are frightened, and if assisted dying is legal, somehow this will make us fear doctors, and it will feel doctors want to kill us. I will talk about that argument later. Secondly, with good palliative care means treating people to keep them comfortable, both mentally, psychologically and physically, treat pain, with good palliative care and hospice care. England has a very strong hospice. It's where the hospice movement, hospitals for dying patients, there are one or two in Ukraine, I think, with good hospice care, dying need not be a terrible experience, and there is much truth in that. And a good friend who is a palliative care doctor. She is not religious, but she is opposed to assisted dying because she says, you know, with good palliative care, it usually shouldn't be a problem. Another argument is this is a slippery slope, and soon doctors will be killing off patients. Because you accept in principle patients can choose to have assisted dying, this will lead to a sort of moral degeneration in society. And the fourth argument is that poor, vulnerable old people will be bullied by their greedy children to kill themselves so the family can inherit the family silver. Firstly, well, if assisted dying is legal, whether it is a prognosis of only 6 months or a prospect of a life of suffering, we already trust doctors with our lives at the moment. Why, if a few people, and we're talking about a small number of people, are allowed to bring their lives to an end sooner than would otherwise be the case, why should that suddenly make doctors into killers? I don't understand the logic of this argument at all. My experience, anecdotally, but as doctors, we find it very difficult to face the truth. We tend to treat patients too much. We are so reluctant to tell our patients and their families that it is time to stop, that it is futile, it is hopeless to go on treating people. Most doctors, we are frightened to death ourselves. We want our patients to go on living. I do not see why the possibility of assisted dying should change this. And there is no evidence from the countries like the American states, Oregon, Maine, and Washington State, things like that, and in Holland and Belgium, there is no evidence that making assisted dying legal leads to this degeneration of the medical profession. The problem with palliative and hospice care is it is only available for a small number of people. In England, which has probably the most developed hospice care system in the world, most people, over 50% of people still die in hospital in very bad circumstances. And the people who do get into hospice care are usually young people with cancer, which is a fairly small number of people. The great majority of people who die are, of course, old people. Most of us would prefer to die in our own homes rather than in the impersonal, institutional circumstances of a hospital. And if you carry out opinion polls of how people feel about the prospect of dying, it is the loss of dignity, it is the loss of freedom, the loss of autonomy, which people fear most of all. Pain with modern palliative treatment, pain is not usually a problem, but it's the loss of dignity, having to lie in a bed, being looked after by strangers, often physically very undignified, that most of us fear. There is no evidence from where assisted dying is legal, as I said, that it leads to mass killing of patients by doctors. Yes, of course, there have been examples all over the world of mass killing illegally. It was Harold Shipman in England, there have been some nurses in Germany. This happens, it's a problem, but these are madmen, these are psychopaths, and these are not normal doctors. And but the availability of assisted dying is irrelevant to how they behave. The paradox is, in England, we all practice, as doctors, we all practice euthanasia. I mean, when we have a dying patient who is in a very bad way, I'm sure the same happens in Ukraine. We would often help the patient to die with an overdose of heroin or morphine. This was standard practice when I was a young doctor, because there has been so much publicity in England because of the mass murderer Harold Shipman, who killed perfectly normal patients with morphine, and more recently another doctor. This has now become very difficult. So the paradox is that if assisted dying is not legal, we still often have to practice it, but we do not dare to discuss it with the patient. We say, well, we're just helping the pain, when in fact we know we're helping the patient to die. My own view is it would be better if you could have an open discussion with the patient and with the patient's family as to what is the best way to how to handle their last months or weeks of their life. I do not think assisted dying is an opposition to palliative hospice care at all. I feel the two they go together. And in the event, if you look at the evidence from America, when people if they have a 6-month prognosis, many people express an interest in assisted dying, which gives them the reassurance that if their dying is going to become very unpleasant, they need not fear it. In the event, most people do not choose it when the end comes. So it's almost a psychological reassurance of knowing it is possible if one's dying is going to be very unpleasant. Now, do you really think, this is one of the most commonly used arguments, do you really think normal human beings, if your mother or grandfather have a serious illness, are you really going to say, come on, Grandad, take the suicide pill? Is this likely? Do you think this is many people? Yes, obviously, we all have stories where the family were very cruel and did not look after their parents or grandparents properly. But I think this is very, very unlikely. And again, there is no evidence from countries where assisted dying that this happens. My personal experience as a doctor is more often it was a family who would not accept that the patient was dying. The patient did accept it, but it was a family who could not accept it and wanted to go on treating and treating and treating, even though it was no longer realistic. So personally, I don't think any of these arguments are very strong, but so it goes. And the other point to make is that every time I operate, there is a risk the patient will come to harm. And that means if I do 100 operations, 2 or 3 people will be made worse. They may even die because of the operation. So we say as doctors, well, more people will benefit than will suffer. Nothing is certain in medicine or life. It is always a question of balancing one set of risks against another set of risks. And my own belief, but I agree, it's slightly belief, but there is some evidence for it, is that if assisted dying with safeguards was legal, more people, and it's still a small number of people, more people would avoid undignified, nasty death than would be killing themselves prematurely for one of the reasons I discussed earlier against it. I personally have little doubt that as the years go by, assisted dying will become legal. There is strong public support for it in England and many European countries. In America now, after many years of opposition, the Association of American Physicians, the doctors' organization, now accepts it, as has happened in Australia. So it is a slow social change. It is a very difficult question. As I said when I began, we all find it painful, difficult, unpleasant to think about death and dying. As a doctor, I often have to think about it. I don't know what I will decide. It depends on the illness I develop. But having seen my father die from Alzheimer's, which took many years, I certainly think that if I develop if I develop the early signs of dementia, I would go to Switzerland and bring my life to an end. But I'd much rather bring my life to an end in my own home, surrounded by my family, than having to go to Switzerland. But this is a question of personal choice, and you have to justify overriding people's personal choice, patient autonomy, by saying more harm will come to other people if you make assisted dying legal. And my own feeling, I don't think that's the case. I don't think there is enough evidence to override patient autonomy. And with safeguards, in all the countries where assisted dying is possible, you have to be seen by at least 2 independent doctors who will interview you. This will take quite a long time to make sure that this is really, really what you want. There is good evidence for this, and you're not seriously depressed or psychiatrically ill or something like that with a condition which could be treated. And I think that was the last slide. A difficult subject. I will quite understand if nobody wants to ask any questions. When my friend Dr. Mizak said, will you come and give a talk at Luku, I said, well, my current talk is about assisted dying, but being a Catholic university, I'm sure they would be rather uncomfortable about this. So I'm very impressed that people said, yes, come and talk. But if you have any questions, I'd be very happy to discuss them with you. Yeah.
I will pass the microphone.
Now, I'm sure you all speak such good English that you could understand everything I said. I hope that was the case.
Hi, my name is Ira. I'm from journalist first year. Would you say that the fear of the death is actually us being too attached to our life and friends and family here? It's not by the, we're not scared by the death itself, but it's like FOMO, fear of missing out.
Well, if you believe in an afterlife, which I don't, in theory you should believe in hell, perhaps, and many people don't. It's interesting in America, where 75% of the population are sort of born-again Christians, but nobody believes in hell. Everything's going to be right. Very American. They only believe in heaven. Our fear of death, in a sense, is not rational. How can we be frightened of nothing? If, like me, you do not believe in life after death, there is nothing to be frightened of. But instead we are frightened of dying, and it's ingrained in us. I mean, I don't know what chimpanzees and gorillas and animals think or feel. We know elephants will mourn a dead elephant. There is some evidence. We do not know what animals think or feel. But it's a deep, deep fear within us, which in some ways we must struggle against to try to make the right decisions, both for ourselves and for the people we love.
I mean, do you agree that it's more of a fear to miss out on the events that will happen after?
Oh, I agree with that. I'm very annoyed about having to die. I want to know what happened. Yeah, I agree. My wife and I often have this discussion. We really, really want to know what happened. Although the world is such a depressing place at the moment.
But I would love to see people reaching Mars, and then I think it would suck, not to see it and die.
Well, it is, but that's life. That's life. We are all going to die. Although we all have, almost all of us, have this inbuilt optimism. We all feel we'll go on living. And as we get older, I was talking to friends of mine. I'm 68 years old, and I have friends who are now in their 80s, and they say, well, I just want another 3 or 4 years life. I say, yeah, in 3 or 4 years' time, we'll say, I want another 2 years of life. In 2 years, it's difficult. It's difficult. But it is quite clear, because in countries like Switzerland, Holland and Belgium, some people, as the end of their life approach, they want to control it. They want to be in charge of the end of their life, and they can overcome this natural, unrealistic optimism from which we all suffer. Talk to anybody my age, and I've reached an age now when I see a photograph of myself, I'm shocked. I look so old. I feel so young inside. And my patients are all like that as well. Oh, Mr. Marsh, I feel so young. And I say, no, you're not. So this is human nature.
Hello, my name is Oksana, school journalist. Thank you for the lecture. I have a question about doctors.
Mm-hmm.
You spoke a lot about patients, about how do they feel, and I'm interested how is there any work with doctors I mean, is there any psychologist who speak with doctors who are included in euthanasia process? Because I can judge, but I think it's really hard for them, and I think that they should have some support, and if they do, what is really mean?
Well, first of all, it is saying with abortion, in England anyway, no doctor is compelled to carry out abortions. If you are willing to do it as a gynecologist, then you can do it. If you don't want to do it, and some gynecologists in England do not want to do it, then that's all right. It is the same in Holland and Belgium. Many doctors do not want to practice assisted dying. Either they find it too upsetting, or they disapprove of it for various reasons. So there is no compulsion on doctors to do it. There is not very much written about it by doctors. There is a Dutch doctor called Bill Kaiser who wrote a book called Dancing with Mr. D, which is he occasionally will carry out assisted dying, and it's a very thoughtful account of how difficult it is. But the fact of the matter is, some patients can make a clear, rational decision that that is what they want, and why? Who are we to disagree with that? There is very little written about this. It's becoming an issue in America and Western Europe. In fact, next week in London, I'm talking at a big international conference about doctors' mental health. And there is a lot increasing discussion about the psychological strains of being a doctor. There's very little written about the psychological strains of being surgeons on the whole. But it is an issue, and the long hours, the stress at the work. In some ways, if you work in more dictatorial medical systems, as it used to be the case here, certainly in the Soviet time, perhaps it's a little bit less stressful for doctors because the patients are told they're dictated to. But certainly in England, now we are more and more, what we do is more and more transparent. There is more legal litigation against us. The newspapers are always writing articles about bad doctors. There is more and more interference in medical work from managers for various reasons. So in many ways the work is becoming more and more stressful. But ultimately, coming back to dying, the most stressful bit is what I was doing this morning in Orlika Street, which is looking parents in the eyes and saying, we cannot help. Your child is going to die. And I think it's terrible for the parents, but that's very difficult. And you can see why many doctors, especially in Ukraine, in my experience, tend to run away from this and do not speak the truth. But again, in some countries, patients and their families do not want to hear the truth. I work a lot in Nepal, in Kathmandu, which is one of the poorest countries in the world. It's a very strongly religious, superstitious culture, both Hindu and Buddhist. And there the families, this is particularly dealing with problems in the brain, they simply will not accept that somebody will die. They want everything to, they want all treatment to be given, even though as a scientific doctor you tell them this won't work. And if they don't like what you say, they'll go to another hospital, or even on one occasion the family smashed all the hospital windows because they were so angry with what was going on. So it does depend on the culture to some extent. My colleague in Kathmandu would say, look, you can't really tell the patients the truth, the families the truth, because they'll then run around the hospital screaming and shouting, causing a terrible fuss. So again, all these questions, it does depend on the culture of the country. In England and America, almost always, patients and their families want to be told the truth. They may not like the truth, but they would rather know the truth than not know the truth. And again, we try very hard to tell the patients and the families the same truth. I've worked in some countries, this may still be the same in Ukraine, I don't know, where you don't tell the patient, the family say, you must not tell them they're dying. And then you create this difference in knowledge between the family and the patient. And it's quite clear the patients usually know what's going on. You know, just from the facial expression of the doctors or their family, they know they're dying. But then you prevent, by giving a difference in knowledge between the family and the patient, probably it makes things worse. It may make things easier in the short term, that they can go on pretending everything's all right. But in the long term, personally, I don't think it's a good idea. Yeah.
Hi, my name is Maria, School of Journalism. I want to ask you a question about, well, I think it might be like more even political issue than, and it's become part of religion because, first of all, it was a political issue, that how countries treat with suicide and suicide in general. I think it's like that people want to, actually governments, but general politician government wants to control even the death of person. That there's like people are not treat with respect to the people that they have a right to choose rather they want to die or live, and it's like more about political, more about are people behave as a grown up and who have a right to choose, or government wants to control even this.
Well, I agree in principle. The problem, of course, is with psychiatric illness, people become very depressed, and particularly in young people who kill themselves, it is often very impulsive. They do it, we say in English, on the spur of the moment. And I have at least 3 friends I know whose children committed suicide at the age of 19 or 20. And I think as a parent, one of the most terrible things you can experience is suicide by one's child. You feel guilty, even if it was not your fault. You feel guilty for the rest of your life. It's a terrible thing. And so the point is, of course, a lot of suicide is temporary with psychiatric treatment. It can be stopped, and many people are then fine afterwards. So the important point is to make sure that people who ask for assisted dying are not depressed in a way which can be treated. Now, if you have a terrible cancer and you know you're going to die fairly soon, well, it's reasonable to be depressed and maybe to want to bring your life to an end. Now, it is true, whereas this is very controversial. In Belgium and Holland, in Belgium and the Netherlands, you can have assisted dying on the grounds of untreatable depression. These are people who probably tried to kill themselves many times already and for various reasons have failed. Most doctors are uncomfortable about that. I'm uncomfortable about that, and I don't have a strong opinion about it at the moment. But in most countries where assisted dying is possible, that is not, depression is not a grounds for asking for assisted dying. But I agree with you, but the principle of the question of assisted dying is really a question of patient autonomy, freedom of choice.
A minute of philosophy. What our death can tell about our life?
Death, yeah. Good question. I think in the state of Bhutan in the Himalayas, which I've not been to, but it's next to Nepal, they have some sort of public policy that everybody should think about their death every day. The meaning of death is, for me, is how we live our lives now. Now, when we are young, death is far away. We have ambitions, we want to have a career, we want to have families and children, which is all very biological. By my age, for me, although I still hope I can be useful, and that is why I come to countries like Ukraine and Nepal to work still as a doctor, But my concern is, it is possible that I'll be lying on my deathbed, able to look back. I will no longer have a future to which to look forward. And the question then is I will only have my past to look back on. And the conclusion to this is very little different from the Catholic belief in good works. There is a famous English Catholic medieval play called Everyman, who then dies and is standing in front of God at the Last Judgment, and all his money, his friends, his wealth is meaningless, and all he has to defend himself is his good works. And I feel I want to be able to look back at my life and feel that's something I can look back on and feel, well, I achieved something. What does not help in life is having bigger cars, staying like all these millionaires and oligarchs who have homes all over the world and Rolls Royces and Maseratis and Lamborghinis. That's a complete waste. It's not only just ruining the planet. You cannot, when you're lying on your deathbed, what pleasure will there be in the fact that I had a house in the south of France, But instead, it's what we've done to help other people and try to make the world a better place. That is what is important. That, for me, is the message of death. It's how I live my life now. And you all have your lives ahead of you, so you've got plenty of opportunities to improve the quality of your deathbed memories and reminiscences.
Ms. Marsh, National National Academy of Arts. While I was translating the article about assisted dying, which was very easy actually for me, there were mentioned some cases of different people who were allowed to die, especially in Switzerland. But one case was peculiar. That was middle-aged man who was alcohol addict, and he was allowed to die. What is your opinion? Do you believe that people who are drug or alcohol addict should be allowed to...
that was the case in Holland, wasn't
yes,
it?
Yes.
The case in the Netherlands. It led to a lot of controversy at the time. I'm pretty unhappy about that. It's similar to saying if people want euthanasia on the grounds of depression. I mean, I accept that some people are so depressed or so addicted to alcohol, their future is hopeless. But the difficulty is where do you draw the line? And there I would be worried about what we call in English the slippery slope. So perhaps in those cases, although there will be some people who perhaps would have benefited from assisted dying, it is maybe better not to allow that because it's so difficult to... It depends entirely on the judgment of the doctors then, as to whether they are really depressed or not. And that makes me uncomfortable. So I don't really agree with that aspect of the law in Holland.
Hello, my name is Alessandra, a program of media communication. My question is, do you slightly believe that suffering can help to purify soul or something like this?
Well, yes and no. I don't think suffering at the end of my life will purify my soul at all. My philosophy of life has usually been no pain, no gain. Everything worthwhile in life is usually a struggle and hard work. I've learnt more, both as a human being and as a doctor, from making mistakes and things going badly than from things going well. Pain is a way of teaching us things. We learn, if an experience is painful, we learn something from it. I went through a very traumatic divorce from my first wife more than 20 years ago. I behaved badly. I think my first wife probably behaved badly as well, but that's up to her to say. And I still regret it, but I know it made me a better person, I think, because I realized I learnt many painful lessons about myself. But at the end of life, if I'm dying or faced by dementia, I don't see any value in pain. I suspect, and perhaps the Catholics will correct me or criticize me here, I suspect there has been an element in the Christian tradition that you have to suffer in death in order for your soul to be reborn. But that is something that does not apply to me because I do not believe in life after death.
First of all, thank you very much for your election, and I will have two questions. First one, what people actually do maybe one day, hours before they will die, and how to explain to Ukrainian doctors that the patient must know when he will die or how much time he needs. Thank you very much.
Well, I can only, when I come here, I can only set an example. People can read my books, which deal a bit with this. I'm an outsider. I come from a different culture, although we're all part of Europe, whatever Brexiteers may think. For Brexit, no, shut up. So, by coming regularly, making friends with doctors here, and when we have very, very painful conversations, as we have just had this morning, they can see how I approach these problems and they can decide whether that is what they would want to do themselves or not. But I do feel that setting an example is always the most effective way of teaching in medicine, rather than sort of writing theoretical lists of instructions and rules. But but the first thing to admit is how difficult these problems are, difficult for doctors and patients. Does that answer your question a little bit?
I think yes, because in my opinion, most of the patients, they are more ready for death than some doctors.
Well, I think you're right. I agree. That's my experience in England as well.
I suppose that in Ukraine we have much more of these situations.
Yeah. And the problem is, as doctors, for us, a patient dying is a failure. A book was published in England this year by a psychologist who looks after medical students and young doctors who are finding it very difficult to cope. So the book says it's about the psychology of doctors, but really it's about the psychology of doctors who find the work too difficult. And there's one chapter where she is in a hospice, watching a palliative care doctor. And she says what a wonderful doctor he is. And she says all doctors have so much to learn from palliative care doctors, which shows a complete 100% misunderstanding. When you're a palliative care doctor, we all have accepted the patient will die, and the problem is simply one of keeping the patient and the family psychologically in as little pain, mental pain, physical pain as possible. When you're a doctor who's still trying to save the patient's life, you have all the stress and anxiety of failure. And we're very reluctant to accept when death, and it's so frightening. We want to go on treating, and it's very difficult. And when you tell somebody, I had this problem often in my work with patients with severe head injuries. It's always very difficult. You cannot be certain about the future. If I would see a patient with a very bad head injury, I knew that probably the patient would either die despite treatment or be left terribly, terribly damaged, disabled, unable to live any sort of independent life. But then to tell the family that is painful. I mean, I'm frightened. Maybe I'm wrong. Maybe there's a 5%, 2% chance that the patient actually will make a good recovery. And most doctors are so frightened of missing even a 1% chance of a good recovery, they will go on treating. And in fact, we saw a child like that this morning in the hospital, who 2 months after the head injury is in a terrible state. And all my instinct, all my knowledge tells me if he survives, it would be a disaster for the family. But then telling the parents that is awful. And what I said is, well, if that was my grandchild, I have 3 granddaughters, and I love them all greatly. If that was my granddaughter, I would say to their parents, my daughters, I'd say, well, actually, better to let them die. But that's very difficult, very difficult. So we run away from these problems, partly because of the uncertainty. You know? And I think one reason, perhaps I got better at it as I got older, was I was more willing to accept I might be wrong. It means it must hurt if things go badly. If it doesn't hurt, you won't learn anything from it. So it's very important to recognize that pain is important and is part of the work. Black humor is very important. Humor does not mean you don't make a joke in front of the patient, but doctors like making black jokes behind patients' backs, and this is a psychological way of relieving the stress. And the blacker the joke, the better the joke. We do that because we love our patients. If we did not care, we would not have to relieve the stress by making these jokes. But of course, personalities differ. I know some doctors where it does not hurt when their patients do badly. Usually they're not very good doctors. They may be very good technical surgeons, but there's no point being a good technical surgeon if you make bad decisions as to when to operate. And again, in terms of coping with the stress, having good colleagues, feeling you're part of a team, part of a family at work, is very important. It does not mean surgeons on the whole do not cry on each other's shoulders. You know, we do not believe in expressing our feelings very openly. But it is good to have colleagues where you know they understand what it feels like when things have gone really badly. So I know surgical departments where the surgeons all hate each other and they're all locked in conflict and they cannot divorce their colleagues in the way you can divorce your husband or wife. So there's a constant state of psychological warfare in the department, and that's bad. That's bad.
Hello, my name is Rina, Media Communication. Well, could you say a couple of words about, as a writer, about your books and about Ukrainian translation of your books?
Well, I can't judge the Ukrainian translation, alas,
Mainly work
because I don't speak Ukrainian. But I'm told, particularly the first volume, where is it? It's been gone away yet again. He's always buggering off. Yes, anyway, I'm told the first translation reads very well by my colleague Andrew Nizak. I always wanted to write. It's not that I was a doctor and then became a writer. It's almost as though I became a doctor so that I would have something interesting to write about. But I wrote it, I've always kept a diary. I always wrote about my work, but only for myself. And all my writing really is a sort of internal dialogue within myself. It's important when writing is that this is something you want, a problem you want to solve for yourself. It's not just you want other people to read it and be impressed. Secondly, I know that the Ukrainian literary intellectual tradition is perhaps different from the English tradition, but the English tradition is, on the whole, always one of keeping things very clear and very simple. Never use two words when one word will do. I suspect in Ukraine sometimes you prefer to use four words when one will do, but that's a different thing. And then the other vital point about good writing is criticism. Everything, I ended up publishing my books because my second wife, who was a very successful, very good writer and anthropologist, in fact I was presenting her book on Englishness and Ukrainian translation at the book forum this weekend. I used to read to her my diary if she asked me what I was doing at work. And she told me I should make it into a book, which I did, because I obey my wife, I trust her greatly. But everything I write, I show to Kate, my wife, first, and she's a very, very good critic. So with my first book, she had a look at it, and about half the book got cut. I then went to see the literary agent, and he cut half of the half. And then I went to my editor and my publisher, and she cut a half of the quarter. So, and it got better and better all the time. So one of my daughters is a novelist, and she did a master's degree at the best creative writing course in England at the University of East Anglia in Norwich. And there, what you do is you write, but then you sit down in a room with all your other students and read what you have written, and you listen to their criticism. And it's the same with medicine, that in difficult surgical decisions, you're more likely to make the right decision if you discuss it with colleagues. And it's very important to escape from the idea that the professor is always right and the professor's word is law. So openness, criticism, things like that are very important to good writing. And if you're lucky, you have something interesting to write about. And I was lucky because actually everybody's interested in, well, they're not interested in brain surgery, but we're all interested in the sort of psychology of surgeons, which is why medical soap operas, ER, Grey's Anatomy, The Resident, are so popular. I'm sure they're popular in Ukraine as they are in England and America. And although it is boasting, and as an English person I'm not supposed to boast openly, the fact my first book has been translated into 30 languages and sold almost 1 million copies shows, I discovered something people wanted to read about, and I was lucky. Right, are you all exhausted?
No.
No? Any more questions at all? Anyway, once again, I'm very happy to be here again. I'm a great admirer of Uku. I'm not a Catholic, but there are many good things about Catholicism, and Uku is one of them.
Thank you.